With Session Update, I'm Julie Bartke. In its last stop prior to the governor's desk, the Minnesota Health Insurance Exchange Conference Committee report made its way to the Senate floor. Now, at this stage, the legislation cannot be revised, but there were plenty of dissenting voices heard before passage of the bill.
I'm extremely concerned about this, again, the most powerful board in the state of Minnesota, having no checks and balances, no boundaries, no ability for us to come back and say, what are you doing? How much money are you spending? And when it comes down to the spending, here we have a whole new funding mechanism, 1.5% withdrawal or withhold the first year, up to $20 million out of the general fund. And my question to that is, where is that $20 million coming out of? Is it going to be long-term care funding? Is it going to be the AMFIP population? Is it going to be the programs for our homeless youth? $20 million is a lot of money.
At the end of the day, having voted no to the first bill and then no to or voting to send it back to conference, those were my opportunities to change the bill before us. At this point, I no longer have that opportunity. All I can do is decide, am I still for an exchange or am I not? And so I'm going to vote for this exchange, and I'm going to vote for the exchange because I think it's important that we continue this dialogue, that we stand strong for a Minnesota exchange, and then that we be open and willing to work with it as the process goes forward.
Members, this bill is a disgrace, and we should reject it. If you care about consumer choice, you should reject this bill. If you care about accountability and how we govern these kinds of things, as was pointed out, you should reject this bill. If you care at all about what a free market is, you should reject this bill. If you care about fiscal responsibility, you should reject this bill. If you care about having Minnesota have the ability to make laws and govern our own state with matters of health care and insurance, you should reject this bill. And if you believe that we are free citizens and we have the right to make decisions about our own health care, you should reject this bill. Members, vote no.
Senator Bonoff's point about this being a starting place, she's absolutely right. This is just one piece. I understand this is a cornerstone of the Federal Affordable Care Act, and it's been a matter of some controversy for all 3 years that it's been in existence, but I'm proud to be standing up here on the Senate floor today proposing a bill that'll move us forward on the exchange. This is largely health insurance reform, and it's a foundation upon which to make sure that people have access to the care that they need.
The final vote on that bill was a party line 39 to 28.